Welcome to the International Conference on Pain Management and Research. On behalf of the organizing committee, I want to thank all the physicians, researchers, clinicians, and healthcare practitioners for joining us today. My name is Dr. Traci Patterson, and I'm here to discuss with you holistic centered treatment for complex regional pain syndrome. Now, before we jump into that, let me tell you a little bit about who I am and why I'm so passionate about bringing awareness, advocacy, and treatment options to those living with CRPS. First and foremost, I want to say that I am a CRPS survivor. I'm also the founder of Advanced Pathways, the creator of Holistic Centered Treatment Protocol. Now, people who know me within the field or within pain management, or even some of the patients that I've treated, would say that I'm an internationally renowned clinician, a researcher, a hypnotherapist, a speaker, a published author, and even a trailblazer for those living with CRPS. Yes, I was diagnosed with type 2 CRPS, complex regional pain syndrome, following a foot and ankle surgery. Now, CRPS is characterized as that rare incurable disease, a debilitating neuropathic condition. It's also known as a suicide disease. But for myself, I stand here talking to you today as that CRPS survivor. As someone that lived with CRPS for 7 years, but yet I'm in front of you pain-free from this rare incurable disease. So I went through 7 years that felt like I was dwelling in the depths of hell, and that's the easiest way of putting it. And I think that may bring some truth to what it's like. I went through all the traditional treatments that most of your patients would go through, and most patients dealing with CRPS have endured. A plethora of medications, too many to count, years of physical therapy, blocks, local, regional, even 13 lumbar sympathetic blocks. I even went through 2 spinal cord stimulators and a battery change, and finally the removal of all of the hardware, following a buildup of scar tissue on the dura that I was told could eventually paralyze me, in addition to having CRPS, which is that rare incurable disease. For me, that wasn't an option. So we took out the last spinal cord stimulator, and unfortunately I was told I was the rare patient where the spinal cord stimulators allowed my CRPS or caused my CRPS to spread all the way up to my shoulders. So it started as CRPS in a foot and ankle, eventually moved all the way up through my body to my shoulders. And that's what happens with a lot of CRPS patients. Now, over the next several years following the spinal cord stimulator removal, I traveled the world. I traveled the globe looking for answers, solutions, something that would give me my life back, because I refused to believe that in the 21st century that we didn't have an answer or a solution to CRPS. So before we start jumping into CRPS, let me talk to you a little bit about the incidence of chronic pain, and let's start with the United States. If we look at chronic pain at this point in time, the statistics are showing that we have approximately 100 million Americans dealing with some type of chronic pain. That is 1 in every 3 Americans dealing with some form of chronic pain. Now, if we look at diabetes, coronary heart disease, stroke, and cancer, the sum of those 4 diagnoses still does not equal the number of chronic pain patients in the United States. Yet we have millions and sometimes billions of dollars going into research for diabetes, stroke, coronary heart disease, and even cancer. I think if we look at the numbers that are associated with chronic pain and even pull those out worldwide, there's an estimated 1 billion people worldwide living with some form of chronic pain. Those numbers are staggering. As a matter of fact, I would be on the verge of calling it an epidemic. But yet we don't have the money, the funding, or the research going into chronic pain that we have going into other diagnoses, and that needs to change. So let's start talking about what is CRPS and what does it feel like? But before I delve into that question, let me ask the physicians, the researchers, the clinicians, and healthcare practitioners here with us today, how many of you know what CRPS is? You can have a show of hands or however you want to do it. How many of you ever diagnosed CRPS? Perhaps know of the condition, or even know of anyone personally that may be diagnosed with it. The reality is it's very few of you. So I hope that this presentation will bring some awareness and advocacy to a very real condition that the numbers continue to escalate on. So let's think about a feather and a foot. If you touched your foot with a feather or somebody else did, in a normal person, that would tickle. It would be funny. You know, you'd have a little giggle out of it. But the reality is for somebody who's living with CRPS, that feather touching the foot probably creates a horrible sensation. Imagine a burning sensation, a blowtorch. That's what a CRPS patient is dealing with. So here are a couple examples of CRPS and patients that I've treated. The one on the left, a hand and a wrist. Noticing the swelling, the edema. Notice the shininess and the tightness in the skin. And that's all from CRPS. The patient on the right, notice the discoloration in the left foot compared to the right foot. Notice that red, molten blue, purple coloration. Again, CRPS causes vascular changes, vasomotor restrictions, and reactions. It causes temperature changes in addition to a plethora of other symptoms that we'll talk about shortly. Now, to have a better idea of what CRPS is and the type of pain that we're talking about, let's look at the McGill Pain Index. Now, the McGill Pain Questionnaire, also known as the McGill Pain Index, is a scale of rating pain developed by McGill University in 1971. It's a self-reported questionnaire that allows individuals to give their doctors a good description of the quality and intensity of pain that they're experiencing. So you'll notice that CRPS is put at approximately a 45 out of 50. That puts the incidence and the quality or the intensity of the pain for CRPS above natural childbirth, above an amputation of a digit, a toe, or a finger, above the pain of fibromyalgia, above non-terminal cancer pain, and the list goes on and on. So CRPS pain is a very real pain that patients are dealing with. So what exactly is CRPS? Complex Regional Pain Syndrome, CRPS, was formerly known as Reflex Sympathetic Dystrophy, or RSD. I believe the name actually transitioned over in approximately 1995. And CRPS, RSD, is a chronic neuroinflammatory disorder that runs off of fight and flight, this sympathetic overload. It's classified as a rare disorder in the United States, but yet we have approximately 200,000 individuals experiencing this condition in the US alone on any given year. Yeah, CRPS is a form of chronic pain that usually starts in a limb, an arm, a leg, a hand, an arm, a foot, or a finger. But that's not always the case. And CRPS typically develops after an injury. It can be a sprain, a strain, a surgery, a stroke, a heart attack, or even a snowboarding accident. But when we look at it, the pain is out of proportion to the severity of the initial injury, accident, etc. In CRPS, we'll call it a complex condition that is centrally mediated. So CRPS can spread and it can move, and I think there's some misinformation out there about that. The reality is CRPS can spread, it can move, it can mirror to the opposite side of the body. So for example, if somebody has CRPS in a lower left foot and ankle, it has the ability to mirror to the right side. It also can spread to other areas of the body without an additional injury. So we need to look at CRPS as a centrally mediated disease. That means that it's running in the central nervous system. Now there's CRPS type 1, which is where we don't know that there's a known injury to the nerve. And then there's CRPS type 2, which means that we do have definitive information showing that there was an injury to a nerve. It could be an extensive injury or it can be an innocuous injury. But the reality is, whether it's type 1 or type 2 CRPS, the symptoms are identical. And that's what the patients are dealing with. In my personal opinion, CRPS is the perfect storm in the brain and in the body. With all of the people that I've treated over the last 6+ years with CRPS, hundreds and hundreds of CRPS patients, what I find is it is the perfect storm in the brain. CRPS occurs when the nervous system and the immune system malfunction as they're responding to an injury, an illness, tissue damage from trauma, etc. Think about the nerves misfiring and sending a constant pain signal to the brain, where the brain has to evaluate that, but then because it's a misfire, a miscommunication, then the wrong signal is turned around and sent back to the area that's affected. And many times, if we look at the time right around the incident, the injury, or the surgery, there's a lot of stress in that individual's life. And most of the time, if we look at a 30, 60, and a 90-day window around the time of injury, there was also a drop in the immune system, thus creating the perfect storm for CRPS in the brain and in the body. So what are the typical symptoms of CRPS and what are the patients living with? Signs and symptoms of CRPS will include the continuous burning, throbbing pain. It can be anywhere, an arm, a leg, a hand, a foot, or in the torso, back, shoulder. Sensitivity to touch or cold, allodynia, swelling, edema, skin changes, temperature changes, altering between hot and cold and sweaty. And then we have the skin coloration changes, in addition to the temperature changes. Changes in the skin texture, which can become tender, thin, or shiny in the affected areas. We can also have abnormal hair and nail growth, joint stiffness, swelling, even joint damage. And then add in muscle spasms, tremors, weakness, atrophy, dystonia. These are all things that the CRPS patient is dealing with. So let's take a minute and look at how is CRPS diagnosed. Typically, the patient's sent to a pain management doctor. Sometimes it's a rheumatologist making the diagnosis. Other times it's a neurologist. But the reality is, here in the 21st century, in 2020, there still are no medical tests definitively to diagnose complex regional pain syndrome. There's not one clinical test out there to definitively diagnose it. So instead, the tests that are run to be able to rule out other possible conditions. And once everything else is ruled out, then the physician's going to use what they call a Budapest criteria to diagnose CRPS. So they're looking at the signs and the symptoms. The Budapest criteria differentiates between signs which are seen or felt by the person or the physician carrying out the exam, and the symptoms which are reported by the patient. So when we look at the symptoms under the Budapest criteria, for a diagnosis of CRPS, the patient has to have at least one symptom in 3 of the following 4 categories. Sensory, so hyper or abnormal increase in sensitivity, allodynia. Vasomotor changes, so skin color changes, temperature changes, a difference between the left limb and the right limb, for example. Pseudomotor, edema, swelling, sweating changes, and then also motor-trophic changes, decrease in range of motion, motor dysfunction, meaning weakness, tremors, muscle spasms, dystonia, trophic changes. And then the signs, and at the time of the clinical examination, at least one sign has to be present in 2 or more of the following categories. Again, going back to sensory, the second one is vasomotor. The third one is pseudomotor or edema. And then again, the fourth one is motor and trophic. So those are the specific criteria, the signs, and the symptoms that have to be present for someone to be definitively diagnosed with the Budapest criteria. But I want you to hear that CRPS is more than just the symptom of neuropathic pain. CRPS patients are affected by the physical pain, so physically, but then there's also other aspects of how that pain at such a high level affects their daily life. So when we look at it as a whole, it's physically, mentally, emotionally, relationally, and even spiritually. Those are all of the areas that are impacted by that one patient. So if you think about that, there's no way to quantify the loss to the individual, much less the socioeconomic impact when we look at it this way, because there is no price tag that you can put on the aspects of the mental, emotional, spiritual, and how that affects a person's life. So when we look at conventional traditional medicine, these are the typical steps within a flow chart, so to say, that the CRPS patient will go through when being treated. Again, following a diagnosis, then typically their physician's going to talk to them about physical or occupational therapy. They're going to talk to them about medications, NSAIDs, perhaps an antidepressant. Anti-seizure medications are used off-label for CRPS all the time. Muscle relaxants, and last but not least, opiates. But now that we're into the opiate epidemic for several years, the reality is most physicians are under-prescribing opiates. And that's a whole nother conversation for another day. The next step is typically looking at sympathetic nerve blocks or stellate ganglion blocks. And when all of those fail and the patient continues to progress, then the physicians are going to start talking to the patient about a spinal cord stimulator, also known as neurostimulation. And the latest and greatest out on the market is a DRG stimulator. Now the problem is, a stimulator is nothing more than a Band-Aid. It's not going to stop the CRPS, and it's not going to stop the progression of CRPS. Yes, all of these can provide a decrease in pain for some patients. But then there's other patients, such as myself and many others that I've treated, that actually have an reaction, an abnormal reaction to a spinal cord stimulator. Perhaps we're building up more scar tissue than the traditional patient. The problem is there's no research to know why. With CRPS, a lot of patients, when they put in the spinal cord stimulator, their CRPS actually moves into the area where it's been implanted. So that again is a negative instead of a positive. So it's all about what is going to be the reward versus the risk for the patient. When those things fail, then a lot of patients have their physicians talking to them about the ketamine infusions. And a ketamine infusion, again, is not a long-term solution. It is enough to help break the pain loop for a short period of time. It's enough to give the patient relief and potentially get them to a zero pain level. But the reality is they have to continue to do ketamine infusions anywhere from every 2 to 3 months, sometimes as long as every 4 months out. And when the patient doesn't get relief from that, or they fail all of these things, then a lot of the physicians are talking about nerve ambulation. Now here's the problem with nerve ambulation. Whether you're doing it through radio frequency, cauterizing, however you're using it, cutting the nerve, etc., transplanting the nerve into a muscle, I've heard that too. The reality is with a CRPS patient, they may get minor relief at the beginning or maybe a lot of relief at the beginning. But as that nerve regenerates over time and it starts to come back and regrow, then the reality is CRPS is going to rear its ugly head again because you're merely trying to treat the symptoms at that specific spot. But you have to keep in mind that CRPS is centrally mediated. So it's much more than just the symptoms. And when patients fail all of that, some physicians are even talking to them about pain pumps. So what is the problem with looking at all of these traditional conventional treatments? The problem is most CRPS patients are not getting relief from traditional conventional allopathic treatments. As a matter of fact, most CRPS patients are getting worse with these treatment options. And it's frustrating not only to them, their caretakers, their families, but also to the physicians treating them. So why is traditional medicine not working for this diagnosis and this demographic of patient? The reality is by the time that the pain becomes chronic, it can't be treated like an acute injury. It can no longer be treated as a sprain, a strain, or a fracture. Simply treating the symptoms is not helping. Again, the bottom line is CRPS is centrally mediated. Therefore, just treating the symptoms does not work. So let's take the next step and start talking about holistic centered treatment, HCT. It's a holistic approach to healing and hope. And we're redefining the healing experience through the integration of holistic modalities coupled with cutting-edge science. I look at it as a 360-degree individualized approach to health. So think of it more or less as a blueprint that can be customized to meet the specific needs of each patient and their goals. So our approach focuses on treating the whole person while also addressing the coexisting conditions. Holistic centered treatment is an individualized approach. It's treating the patient as a whole, not just the symptoms, as I just mentioned. It's evidence-based, it's non-invasive, and it's drug-free. And it's working with the biology and the physiology of the body. Effectively working with neuroplasticity in the brain is an amazing way of being able to work with CRPS patients. And then roll all of this into a healing environment that's created by someone who actually lived with CRPS and understands what the patients are going through. And then all of a sudden you have a protocol that's making a huge difference. It's taking leaps and bounds above and beyond traditional treatments because we're addressing all aspects of CRPS physically, mentally, emotionally, and even spiritually. So what's the difference between holistic centered treatment, HCT, and conventional medicine? Well, a big difference is HCT is a multimodality protocol that's individualized to meet the specific needs of each patient and treating them as a whole. Whereas when we look at conventional, traditional medicine today, it's piecemealed. You go see an orthopedist, you go see your rheumatologist, you see your pain management doctor, you see the neurologist, and then you have a primary care physician. Each is working on a specific area of the body. And then you also have a lack of communication between all of these people. But with traditional medicine, it goes back to the fact that we're treating the symptoms. We're not looking at the underlying cause, and we're not treating the person as a whole. So HCT, again, it's evidence-based, it's non-invasive, it's a drug-free treatment option that's actually helping CRPS patients to regain function and to regain their lives. And many of these patients are actually gaining long-term remission, meaning staying pain-free. So some of the modalities that are included in holistic center treatment: neuroplasticity training, laser, PEMF, hypnotherapy, biofeedback, neurofeedback, light sound therapy, movement therapy, talking about nutrition and dietary needs, etc. So the philosophy and the science, it's simple. The majority of chronic pain patients are in fight and flight, especially CRPS patients. When we look at CRPS, it's running off of fight and flight. It's the sympathetic overdrive of the autonomic system. So they're in that sympathetic overload state. And this, in turn, can create the limbic system dysfunction. So think of it as that perfect storm we talked about a few minutes ago in the brain, where the wrong signal is being received, the wrong signal is being sent out, essentially creating pain where there shouldn't be any. And in addition to that, the brain is also sending out peptides, hormones, neuropeptides, etc., that affect other systems in the body. CRPS patients are dealing with insomnia. They like to call it painsomnia. They're dealing with stress, anxiety, and/or depression. Many of these patients are dealing with PTSD secondary to their diagnosis and the treatments they've been put through. And many of these patients also have coexisting conditions that keep piling up the longer the CRPS goes on. So when we understand the body, when we understand the brain and how everything's interconnected, the biology and the physiology of the body, then and only then can we start understanding CRPS. So let's look at the brain as a great starting point. I will call it the brain-pain connection. Chronic pain, especially CRPS pain, is a completely different beast, a completely different monster than acute pain. It comes from a limbic system dysfunction, add in a wrong message that is perpetuated by inflammation, different molecules that are telling the nerves in the brain that there's a problem. And think of the brain as that most sophisticated computer on the planet because it controls every single function in the body, and we all know that. Everyone here knows that. And there's a file for everything that we've ever done, felt, seen, smelled, or experienced. The amazing thing is that when we understand that biology, the physiology of the body, and that mind-body connection, then we can use this innate ability to actually help CRPS and chronic pain patients heal. So another area in the brain that's very much tied into CRPS is the limbic system. It regulates the function of the parasympathetic and the sympathetic nervous systems, which means it's controlling things like our pulse, our blood pressure, our breathing, even the arousal response to emotional circumstances. The limbic system mediates all aspects of emotional and motivational functions, such as our desire for food, our feeling of anger, fear, pain, and even pleasure. So when we're treating CRPS, we have to address the brain. And some wonderful ways of doing that: one, neuroplasticity, also known as neural neuroplasticity or brain plasticity. Bottom line, the ability for that neural network in the brain to change through growth and reorganization. And that's something that we can work with through neuroplasticity training. Then we have neurogenesis. It's the process by which the nervous system cells and the neurons are produced by neural stem cells. We also have epigenetics, a study of how our behavior and our environment can cause changes that affect the way our genes work. And then we have the glial cells in the brain. These are all areas that we can work with. But one of the first things that we have to look at with CRPS is how do we stop the fight and flight response? The first step to actually addressing CRPS is to address the fight and flight. And this is one of the biggest steps that we are missing with conventional, traditional treatments of CRPS. So when we can get the body out of fight and flight, when we can calm down that sympathetic overload, it allows us to start balancing out the autonomic system, which plays a key role in our overall health. And by taking this step alone, we automatically see the pain levels starting to diminish. So one of the great tools that we have in response to working with fight and flight is clinical hypnosis. Clinical hypnosis is a valuable tool when we know and we understand the biology and the physiology of the body, which we do. Clinical hypnosis allows us to access that part of the brain, specifically the limbic system, that's perpetuating that pain loop. And the reality is clinical hypnosis can actually allow chronic pain patients, CRPS patients, to lower the intensity of the pain. And some even have the ability to physically make the pain disappear. Now, through studies that they've done at Stanford and other universities, PET scans and functional MRIs are showing the hypnotic states can actually alter the subcortical structures involved in the brain, the processing of the pain, in turn allowing sensations that would normally be experienced as pain to no longer have that association. As a matter of fact, over the last 15 years, hypnosis for pain management has been exhaustively researched. Again, MRIs, functional MRIs, PET scans, etc. Researchers are seeing and being able to prove that there are changes that take place in the brain under hypnosis. And that's a very compelling argument to use that in the treatment of chronic pain. Another important piece of this is the vagus nerve. Now, the vagus nerve is that 10th cranial nerve, and it's extremely important. It controls the inflammation of the body, including nerves, GI function, the immune function, just to name a few. And the autonomic system, the autonomic nervous system, is divided into the two parts, the sympathetic, fight and flight, and the parasympathetic, rest and digest. The vagus nerve contains the parasympathetic fibers, so when we stimulate the vagus nerve, not only are we releasing the endorphins, the serotonin, and even the melatonin in the brain, but we're also helping to balance the autonomic system. Now, this is why stimulating the vagus nerve is an important piece in the treatment of CRPS and even other neuropathic conditions. And there are many ways to stimulate the vagus nerve. Now, the reality is now DME companies are wanting to implant a device into patients or even an external device to stimulate the vagus nerve. But in reality, the patients can do it themselves. There are studies that have shown that humming and singing, even taking a proper abdominal breath, allow us to stimulate the vagus nerve. Now, we touched on neuroplasticity very briefly a few minutes ago. So neuroplasticity, also known as that brain plasticity or the neuroplasticity, is the ability of the brain to change throughout an individual's life. So working with neuroplasticity is another key modality in helping CRPS patients regain their lives. So let's step away from medical jargon for a second, and I want you to think about taking a walk on the beach. When you take a walk down by the waves that are coming ashore, every footprint Every place that you step leaves one footprint. So think about that footprint as dealing with something once only. Now the reality is when we are living with CRPS or chronic pain and you're dealing with things 24/7 over and over and over again, like Groundhog Day, it is like putting your foot in the exact same footprint over and over again. As a matter of fact, the longer it goes on, you might as well take a spade and your bucket and start digging a hole. But at the point in time that somebody can actually give you a beach chair to sit down in, and you actually stop digging that hole, and you sit and watch the waves coming ashore, eventually, no matter how deep that hole is, the waves work with the sand on the shore and the tides to completely fill that hole again. And our brain has that exact same ability. Neuroplasticity has successfully been used with stroke patients, with chronic pain patients, even with cancer patients and other diagnoses, because the brain is continually reorganizing itself and forming new neural connections throughout our lifetime. And that's what neuroplasticity is. So working with that actually gives your patients a leg up. We also work with lasers and low-level light therapy, LLLT, also known as photobiomodulation. So lights can stimulate or inhibit cellular function according to the intensity and the time that it's applied. Laser and LEDs produce an intense beam of light at different wavelengths. And when the right or the correct wavelength is put in at the correct intensity and it's used together in a specific area, then all of a sudden we can stimulate repair, we can decrease inflammation, we can promote healing, we can calm down neuropathic pain, and depending on the setting, we can actually help to break up scar tissue non-invasively. So one of the primary mechanisms of the light is being able to work with oxidation and actually getting it down to the cellular level. So there's a lot more information that we can go into this, or if you have questions, please feel free to reach out to me. One of the other devices that we're using, or modalities as we'll call it, is PEMF, pulse electromagnetic field. Now PEMF allows us to actually, again, start getting down to the cellular level. So if we look at a cell underneath a microscope and somebody's healthy, it has a specific ionic charge. When somebody's dealing with CRPS, chronic pain, or any plethora of diagnosis, the reality is the cells lose that charge. So by working with PEMF, it gives us the ability to have an additional modality that actually helps at the cellular level. So add together this multimodality approach and think of it as that individualized multimodality approach, and it's key. It's helping us to address all the aspects of CRPS and even other chronic pain conditions. Neuroplasticity, vagus nerve stimulation, a laser, PEMF, hypnotherapy, biofeedback, neurofeedback, etc. It's allowing us to work with the physical, mental, emotional, and spiritual components of what the patients are dealing with. A holistic approach to treating CRPS ultimately means treating the whole person, and that includes addressing the fight and flight, that sympathetic overload, helping to stimulate the vagus nerve, balancing the autonomic system, breaking the pain loop, addressing coexisting conditions, reducing and controlling stress, anxiety, depression, even attending to PTSD for those people living with it, increasing their restorative sleep, increasing their overall sense of well-being, and providing the patients with the tools to live a fulfilled life. That's what it's about. So let me share a case study with you before we start wrapping up. This was a 14-year-old female diagnosed with type 2 CRPS who flew in from out of country to be treated. When she arrived, her average pain level was a 9 out of 10, 10 being the worst pain imaginable. Sleep quality was a 1 out of 10, and quality of life was a 2 out of 10. She wasn't in school. She was an athlete, but unable to participate in her activities because of her pain levels. She had been treated at numerous universities, hospitals, physicians, to no avail. And her parents actually brought her in a wheelchair because her pain levels were too high for her to walk. Now, she completed a 1-week intensive with holistic centered treatment. And at the conclusion of 1 week, which is Monday through Friday, approximately 30 to 32 hours in that week, her pain level was at a 0 out of 10. Sleep quality was a 9 out of 10. It had improved and she was sleeping through the night, and she put her quality of life back up at a 9 out of 10. Before they left for the week, they actually went to some different outings here in Southern California. So this patient is now 4 years out. She's 18 years old, continues at a 0 pain level. She just started college. She's playing competitive field hockey, ice hockey, soccer, and other sports. So I hope that this one case study alone will show you the types of outcomes that we're getting and the reason why it's so important to treat the whole person. So my message is simple, both to the physicians, the healthcare providers, and also to the patients. Patients with CRPS and chronic pain don't have to suffer, not in silence and not through the cries of agony. Traditional conventional medicine may not have all the answers that they need, but when we combine evidence-based treatments with the latest science and technology, then we can actually help patients regain function. We can help patients regain their lives. And this happens when we're dealing and addressing all aspects of their pain and how it affects them physically, mentally, emotionally, and even spiritually. Again, my name is Dr. Traci Patterson, founder of Advanced Pathways and the creator of Holistic Centered Treatment Protocol. And I'm here to answer any questions that you may have. We'll open it up for a Q&A, but before we do that, I want to thank everyone again for attending, for listening, and hopefully it's bringing some awareness, some advocacy, and opening up our minds about the potential treatment options that can happen when we're willing to step outside of the box, when we're willing to look outside of our conventional treatment options to actually help our patients get better. Thank you again for joining us.